talking about how you can do some physical measurements on your dog at home. So first off, non-slip floor when you're going to be doing this. Okay, that's the first thing. So I've got my very cooperative dog here just to show you the movements, but I'm going to be demonstrating in a moment what to do in terms of getting your dog comfortable in this position. So first of all, with your little emergency card, just to sort of get a rough idea of what's normal for your dog, is you want to do this at rest. And rest basically means you've been in at least a couple of hours after having a good walk or run around. You also don't want them to have been in the sunshine too long or been next to a radiator too long. Basically, your dog has just been pottering around, having a drink, having a little bit to eat, and is just relaxing on the sofa. So any of you with very high energy dogs, it can be challenging to find this time, but you will be able to at some point. So first of all, how can you take your dog's pulse? Now, the easiest way is for you to take it under here. So what you would do is you've got your hand. If your dog is uncomfortable with you going over, which a lot of them are, just come around to the side. Just let your dog know you're here. Use the back of your hand if need be. If you see any lip licking or any trying to move away, don't worry about it at this stage. You can just build up to being in this position, okay? So what you want to do is, for a dog as large as this, use all your 4 fingers. Put your thumb on the outside, but don't put too much pressure on your thumb on the outside, because your thumb has a pulse in it, so it might confuse the situation. Slip your hand right inside. So if I just turn Pup over here, you want your hand sort of around there, okay? You then will be able to feel their femoral pulse. And what you would do is set your timer on your phone to 15 seconds and count how many times before your timer goes off, how many sort of pulses you feel. Then you get that number and times it by 4, and then you've got your heartbeat per minute. Okay, and you do the same with the breathing. So when your dog sat there, again, set your timer for 15 seconds and just count how many times you see rise and fall. So rise and fall is 1, rise and fall 2, rise and fall 3. And then after your timer goes off after 15 seconds, times whatever you counted by 4, and that's your respiration rate. If you've got a smaller dog, obviously you could use 2 fingers over there rather than 4 if it's uncomfortable. Sometimes you are able to get a pulse down here, but it's a little bit more difficult to find. And of course, the other thing you can do to get your dog's heartbeat is under their left hand side. It's flipped on the image, but you put your hand on the chest. Again, keep your thumb off, and then you should be able to feel it. With regards to the third physical feature, the gums. So again, get your dog used to the fact of you being here, okay? Use the back of your hand because the temperature's not as high on the back of your hand, and it's just a little bit more gentle. Again, if you're seeing any blinking or lip licking, just let your dog go away, but it can just help just to sit with them in this position on a non-slip floor and just get them used to this. Because eventually, I say 15 seconds there, 15 seconds there, and a couple of seconds up on the mouth is absolutely fine. But what you want to do is just gently lift the jowls and just have a look at the colour. What you can do as well is always set up your camera. Again, get your dog used to the camera being set up and just literally gently lift and down again, and then check out the footage. It's one of the easiest things to do, isn't it, Fido? Yes, absolutely. And then while you're here, just using the back of your hand, again, you can just check the skin condition, any dandruff, you're noticing any swirls. And if you can just sit down and do this with your dog, I mean, a minimum every, I say 2 months, just put it in your calendar to sit down with your dog and do this is absolutely fantastic. But if you've got some time once a week, once every 2 weeks, just to sit down and to have that baseline, and you can write this information down on your card so that when something does change, you can, especially with regards to the gum colour, if you see brick red or if you see really pale, it's something to call your vet about immediately. But it's just to keep an eye on things, and if something does change in your next regular visit or when you phone your vet up, you can say, oh, I've noticed this, this and this. So it's just a starting point. So here's our real life doggy. Last time she was walked was yesterday evening. She went out to the garden for a wee this morning, but then came straight back to bed. She's had her breakfast as normal about half an hour ago, and she's just gradually sitting here having a rest. So I brought her a couple of treats. I don't want to use treats too much while I'm trying to do the respiration rate, because I won't be able to tell her breath from her sniffing. But I'm just going to give her a couple of treats now, just to sort of get her used to me being next to her, and I'm going to keep a couple of treats for later. Okay, so just coming to sit next to her. There we go. Just going to use the back of my hand just to introduce myself, make sure I've got no signs of distress. So lip licking is one of them, but that is more, she's licking because she's just had something to eat rather than I'm touching her, so she's licking her lips. I'd be looking for a lot of blinking, her turning away, anything like that. So we've got a little bit of a blink there, but nothing major, but she still seems to be fairly engaged. So what I'm going to do now is just bring my hand nice and gently to back of my hand over the jaw there, and then gently lift up. There we go. There we are. Nice pink colour, and obviously we check the other side as well. So let's go around there. I don't do what I did before, which is shove my finger in her eye. So it's just nice and gentle. Oh no, okay, I haven't got no food. Nothing there. There we go. There we go. I'm just going to check your gums. There we go. Nice and pink again. She's recently had her teeth cleaned. She has got black at the top of some of her teeth, but that's just her colouring. And so I'd be looking for, is it very white, is it very red, but just what's her normal colour. And by me filming it, I can also keep a little diary of what colour it was, so I can compare it later on. So your phone is your friend. So the next thing to do is to do her breathing rate. So what we need to look at is her up and down. I'm just going to wait for her to stop sniffing. Then I'm going to set my timer for 15 seconds and count the amount of breaths that we've got. So I'm going to set a timer now. 1, 2, 3, 4, 5, and that's the end of my timer. So I got 5 breaths in 15 seconds. So if I times that by 4, that is 20 breaths per minute. And a dog's normal respiration rate is between 50 and 30, but each dog is different and individual. So you just need to know your own dog. Next is the pulse. Now, this is usually easier in a standing up position, so I'm not sure I'm going to be able to get it. So let's just move my hand over there. I'm just going to get 2 fingers in and bring them in here and see if I can get the pulse. I've got it. So start my timer. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22. So I got 22 beats in 15 seconds. If I times that by 4, that is 88 beats per minute. Now, dogs' heartbeats can vary quite a bit, and normal can be anything from 60 up to 120, and some dogs even a little bit higher. I think the rule of thumb is the bigger the dog, the slightly slower it should be, but like I said, each dog is individual. So I've got pink gums, I have got a respiration rate of 20 per minute and a heartbeat of 88 per minute. So if I'm checking that every couple of months, I can just see what's going on, has anything majorly changed. While I'm here, I can have a look at her coat. If we've got any sign of dandruff. She's molting like mad, as you can see, but that's the weather. Sort of colour of her ears, colour of her eyes, nice and white. I'm not seeing any signs of dandruff. Using the back of my hand, I can't feel any major changes in temperature over her body. Oh, okay. Is that enough? So a little blink there. I think I'll get her a treat for being a fabulous young lady. There we go. And there. And that's the check done.